are you doing today?
I'm great.
Good. My name is Kirstyn. I'm going to be the nurse today who's going to be doing your physical assessment.
Okay.
Can you tell me your name?
Yeah, it's Yolanda's his.
Okay, I'm just going to look at your armband here. And your date of birth?
Yes, it's 8475.
And do you know where you are?
Yes, I'm at the hospital.
Okay. And you know what you're here for?
Yeah, I wasn't feeling very good today, just a little off.
Okay, go ahead and have a seat right here on the table. I'm just going to wash my hands over here. Apply some clean gloves. And when you walked in, I was looking at your gait. It's pretty balanced, not off or anything like that. So in general, I'm just going to start with doing your vitals. These happen all the time. Just going to check your blood pressure here. I'm going to put the cuff on. I'm going to hold your arm up like this. I'm going to pump it up until 30 pass where I can hear your pulse. And I'm going to let it go gradually. And the first noise I hear is your systolic. And the very last noise I hear is the diastolic. Alright, so your blood pressure is 120/80. That's good.
Okay.
Within normal. I'm going to check your temperature under your tongue. Okay, it's 98.2. That's within normal. I'm going to put this thing here on your pointer finger. It's a little device. It's going to check your pulse ox. Alright, and it says 98. That's normal. We want it to be between 96 and 100. Alright, so I'm just going to check your pulse as well. Okay, your pulse is 80, and I'm just going to continue and check her respirations, but I'm really looking at your pulse here, okay? Okay, her respirations are 16. That's good. We want it between 12 and 20. Alright, so I'm just going to continue. I'm just looking at your head here. It looks good. There's no abnormal bumps. There doesn't look like there's any bugs in your hair. Your hair is in good condition. I'm just going to look at your ears. Okay, they're nice and pink, no drainage. Okay, no deformities. Also, I'm going to look at your general appearance. You look to be in good health. You take care of yourself. You're well hygienated. And your mood is appropriate, and your affect is appropriate. You're very pleasant. So I'm going to move on to your eyes here. I'm just looking for symmetry and shape. I'm going to do this test. You're going to look at my nose, okay? And I'm just going to put the light right in front of your pupil on both sides. All right, and as I move the light, both pupils converge at the same time, which is good. And then just follow my pen to your nose and back. Good. So eyes are, pupils are equal, round, reactive to light, and they accommodate. All right, go ahead and open up your mouth for me. I'm just looking to see that there are no lesions, that the oral mucosa is pink and moist. Her dentition is good, and go ah.
Ah.
All right, and her tonsils are not swollen. Go ahead and close your mouth. Now I'm just going to move on to your back here. Just going to listen to your lungs. I'm going to move on to the respiratory.
Okay.
All right. So, first, if you could just take a deep breath for me. All right. Here I'm just measuring that, keep going, that her lungs are rising equally. Her work of breathing is normal. She, as looking at her while she's breathing, she's not using any accessory muscles, nothing like that. She has easy breathing. It's not labored, and her respirations are normal. So I'm just going to take a listen to your lungs as well, okay?
Okay.
Okay, go ahead and take a deep breath for me. Good. Good. Okay, so there we heard vesicular sounds here, and we were just comparing from side to side if there's any difference. I'm just going to percuss here, okay? Actually, I'm going to do the fremitus first. So if you could, when I put my hands on here, if you could just say 99 for me.
99.
Again.
99. 99. 99.
Okay, good. And I'm just going to tap on your back here. Okay, and again, we're just comparing side to side. Everything sounds similar and it's resonant. Okay, so I'm done looking at your back. You know, as I'm back here, I'm looking at your skin and everything is intact. There's no lesions or bruises or anything like that, okay? So go ahead and lay down here with your head at the end here. All right, are you comfortable?
Yes, I'm fine.
Okay, so here we're gonna take a look at your chest. I'm just looking for like any pulsations. I'm looking at your carotids as well. And if there's any pulsations down here at your at your mitral point. And looking for like any lesions or hair, anything like that. So I'm just going to take a listen. Go ahead and take a deep breath. Again. Okay, good. Now I'm just going to listen to your heart. I'm going to listen at the the aortic point first, which is second intercostal, right sternal border. And this is where we can hear S2 sound the loudest. The pulmonic is second intercostal, left sternal border, where we hear the pulmonic valve. Erb's point is third intercostal, left sternal border. Tricuspid is fourth to fifth intercostal, left sternal border. All right, and mitral is fifth intercostal, mid-clavicular line. And this is where we hear S1 the loudest, and it's also the point of maximal impulse. Okay, just going to listen here for a sec while I check here. All right, so the rate and the rhythm are equal between your apical and your one here. All right, so now I'm just gonna move on to your abdomen. Just gonna take a look here. All right, I'm just gonna look for symmetry, if there's any pulsations, if any